Good afternoon, everybody. Thank you for being here. Hopefully people are enjoying the weather and being safe. It's very hot outside. We encourage people to stay indoors and really take the heat seriously and make sure that you're drinking lots of water. We have a lot of different data today. We'll go through that, give our perspectives on it and what we're seeing, and then take some questions. Very pleased we had no new deaths over the last 24 hours. So for the first time in this process, for a period of time, we've had no deaths in the last week. So very good news there. Thankful there. We have lost 188 of our neighbors in this process, and that has been the most painful part of all of this. So we're very happy with that. When we look at testing and new cases, since yesterday we've received 2,072 tests back in Onondaga County. Our mandate for our region is 775 tests a day. We have now reported 2,900 test results since yesterday for the region overall. So the region is doing well, meeting our mandates, and allowing all of us to continue the testing so we can continue to find pockets of the virus that is asymptomatic, but also to try to get in front of the virus when we see it popping up in various clusters. Universal testing will continue at the Syracuse Community Health Center, 9 to 5 on weekdays. Testing has become more available at physicians' offices and urgent care sites throughout the community. And tomorrow we will be doing a mobile testing site at Tucker Missionary Baptist Church, 515 Oakwood Ave in Syracuse. We are doing this in collaboration with 100 Black Men, and I want to thank them for doing this. The testing will be from 9 to 4. If you want to register in advance, please register at our health department website. Looking at hospitalization numbers, we're going to give some details here, so hopefully everybody understands. 51 individuals in the hospital. Of these, 25 individuals are from one memory care facility that has experienced outbreak. It is a cluster. It's driving our data. At this facility, this is not of the level of medical care of a nursing home, so it's been deemed necessary that if you test positive with COVID-19, you are going to the hospital. Whether or not you are sick enough to be in the hospital or not, that's the best way and the safest way to treat these folks. So out of our 51, 25 are essentially in the hospital to receive proper treatment, but are not sick enough to what we would normally send a resident to the hospital with COVID. We have 10 individuals who are waiting on a negative test to return to a nursing home. So the reality is we are looking at a situation where under 20 of the 51 are actually there needing what we would deem regular hospital medical treatment. So that's the data, that's the story behind the data. 4 individuals are in the ICU. Again, it's up 1 from yesterday, but certainly on the lower end of the process. Please think of these individuals, keep them in your thoughts and your prayers. We need to get them out of the ICU and get them home. When we look at the updated hospital numbers on who these folks are, 30 Caucasian, 5 African American, 4 of another race, and 12 individuals that we don't have data on yet. Again, these are the folks coming from the memory care facility. When we look at our positive cases, 2,925 positive cases since March 16th. Up 31 on the day, down a little bit from yesterday. 3 are from a household contact of a previously confirmed case. 7 are from new cases related to senior living facilities. 5 are travel acquired. I will go over where they are at this moment. These are folks coming back into the community. They live here from the state of Florida, the state of South Carolina, the state of Maryland, and downstate New York. Mix of plane and car rides. So these are not travelers coming into the community. These are folks that live here. They go on vacation or are traveling on business, coming back. They contracted the virus in these communities. When we look at 2 are of an unknown origin, we're still contact tracing 14 from the community. Just to reiterate what this means, community transmission does not mean that we don't know the source of the case. In most of these cases, we can contact trace through the source. What this is how we're basically, it's not a household contact or a senior facility, so it falls under community spread. For example, the daycare case that was highlighted in the news today is considered a community transmission case. We are presently monitoring 301 active cases, down 28 since yesterday. The last time we had 300 active cases, it was April 30th. So very good news there. To put this in further context, on June 8th, we had 941 active cases. So 1 month ago, we had triple the amount of active cases that we have today. So certainly very pleased with that progress. We've had 2,441 people recover from the virus. When we look at cases and a little bit more information on who has been impacted, 1,722 are female, 1,201 male, 190 are under 19, 514 in their 20s, 397 in their 30s, 351 in their 40s, 446 in the 50s, 357 in their 60s, 274 in their 70s, 246 in their 80s, 150 in their 90s. To look at some more data, from July 2nd through today, we've had 186 new cases, or about 27 new cases per day. Of the 186, 25 were affiliated with the memory care facility. So that looks like it's a moment in time, a specific cluster. If you took that out of the data, we're at 161. During that same time period, 51 of those cases are from people under the age of 29. While some of those cases are household contacts, young people now are making up about 1/3 of our new cases. Even more concerning is that these kids, it's not the young people who get sick. They're now spreading it to their family members. It could be a sibling, it could be a parent, it could be an aunt and uncle, and that's where the risk comes into play. And certainly when you have a cluster, what we know now is that we have at least 2 to 3 weeks of cases from that initial cluster, and that drives data. We understand it. We box it in and get around it. We have the infrastructure to deal with it. But it's certainly one case, one poor decision. If you're symptomatic and you go to a party, or if you're symptomatic and you do something else, can lead to dozens of cases. And those cases, that's serious disruption. Those are folks that can't go to work. Those are folks that are sick. Those are folks that could end up in the hospital. So we really need to have a gut check moment for our young people, our seniors. We have a cluster of 14 seniors. We understand big summer, but certainly if you think about this, you now have COVID, you're now in isolation or you're now in quarantine. And there's probably going to be more than 14 because of the size of a party. And this puts you in serious jeopardy if these parties continue to happen with when you go to college, because you're all going to get tested going into college. So we're now asking parents to really work with our 17-year-olds, our 18-year-olds, and our 19-year-olds. We need to get these kids tested. They've been very social. This virus is traveling in these age groups, and we need to nip this now and get our arms around this so that these kids can get back to school and don't find themselves in a 2-week quarantine when they get back to school and they get tested. So next week we're going to work with school districts on mobile testing sites to try to educate parents to help get the kids there, and we'll be basing our mobile testing next week around this issue. We have a problem with 17, 18, and 19-year-olds, and we have a problem with younger people socializing. We get that. We understand it. It makes sense. At the same time, we can't have 40 kids at a party and spreading this thing the way that it has without wearing masks and protecting ourselves. So we'll put out a schedule, a testing schedule next week, and we need parents to work with us to get your kids tested. Let's get them tested. If they're asymptomatic or symptomatic now, let's get it under control in July so that when they're going off to college in August, it's not an issue. The reminder of the public, we've seen this. This is almost like where we were in the beginning of this process, where we were saying if you're sick, you need to stay home. It holds true now. We've made so much progress, and we have unforced errors. Think about a basketball game. We're inbounding the ball, and we're throwing it out of bounds right away with unforced turnovers at this point with this virus. We need to stay home when we're sick, no matter what, and go get a test. We need to wear masks. We need to physically distance. These unforced errors impacts our data. That data can be looked at from abroad, and people don't understand the data. They don't understand it's one cluster or two clusters. That can impact the reopening of our economy. Just one or two mistakes. So we need to get better, and we need to get back to our basics. Travelers, certainly we need to understand when we go out of town. At this point, the state has put forward certain states that are having a serious challenge with this virus. If you're leaving to go out of town and it's not on business, it's by choice, you need to understand you're putting yourself at risk. That's your decision, but you need to continue to wear masks when you're in these states to help protect yourselves and your company, your families, because when you come back, you're going to be in a quarantine, and we're seeing these folks test positive. It's happening. So please know this. Please understand that because we've made progress with the virus, it doesn't mean that the virus isn't here. Saying that, looking at, we received a sales tax payment today, brutal, down I think about 50%. It was a cleanup payment from March, April, and May, so it reflected really Q2. I think it was down $4 million at least. But again, just a reminder of the economic toll that the virus has had on us, and certainly need to encourage. I am encouraged by what seems to be action in the United States Senate. Hopefully we'll see a package that has direct payments to localities, or else there will be more pain to come. Saying that, we'll take questions.
You mentioned kids at a party, say 40 kids. Are there specific examples of graduation parties that have led to coronavirus spread?
Yep. I'm not going to say what high school or who the parents were. I know that. I know these answers, but I don't know them through Dr. Gupta's office. You hear these things, and you know, we're a small community, even though we're 500,000, and you learn about these things. So the reality is that kids are doing what they're going to do. Remember when you were a senior. I remember when I was a senior. Very social, various groups of friends within different high schools. Now kids are connected even more via social media. Their friend groups aren't just their own high school. So they're not doing, the intentions aren't bad. It's just we're living with COVID-19. And so having large gatherings, and 40 kids probably isn't a large gathering in normal times, comparatively speaking. In COVID-19, it's a large gathering. So having large gatherings, if you're going to be together, that gathering wasn't technically illegal with the number of people that were there. But when you look at, we know that many of these people weren't wearing masks. We know they were within 6 feet of each other. This is how the virus spreads. So it's happened. There's a theme now. This one situation with this one group of friends will lead to many, many cases. And so we need to learn from that. We knew it would happen. It's happened other places. We need to learn from that now, especially because these, you know, a lot of our seniors now, they're going into college. In a couple of weeks, they're going to go through and start going into schools, and as part of these colleges reopening, they're all going to get tested. So you don't want your first 2 weeks in college, if you test positive, even if you're asymptomatic, you're going to be in a 10-day, 14-day isolation or quarantine. So that's not how you want to start your freshman year out. So let's address it now. Let's have all the parents working with us. Let's get all these kids tested, either at your primary care provider or we're doing universal testing at our sites. Let's get in front of this and figure out who's got it and get those folks better and get them the proper quarantines in place so we start driving our numbers back down to where they were going.
How broad is your suggestion? Is it a high school age person should go get tested? What should parents look for?
Yeah,
in their kids?
parents know if their kids have been active. They know they're hanging out with larger groups or not. They know the answer to this. And these aren't little kids, right? These are 17 and 18-year-olds, 19-year-olds, maybe some 16-year-olds. So this is about them getting in front of this so their lives aren't disrupted in in a month from now when they have to go back to college or when they're going to college. But it's also about anybody in the house who's has medical conditions and or grandma or grandpa or aunts or uncles or neighbors who may be elderly. We have 95-degree days and we have a respiratory virus attacking our community. Those are really tough conditions if somebody gets this. So let's get in front of this. That's a trend. We haven't had a situation in a facility, an assisted living or nursing home in really a month and a half, 2 months. We think the memory care situation's a moment in time. We'll get through this. But if we can stop these types of things, our data gets, really, really good. It's more random. We'll have some travel. We know that's going to happen. And we knew that these things would happen when the economy picked up. We would have pockets of the virus that would reemerge.
There's the child care situation in DeWitt. There's the memory care facility you're mentioning. This graduation party. Is there 3 clusters right now that you're looking at from these 3 situations?
I know what I've read in the newspaper about the DeWitt situation than I do from the health department, but if the information is true that 16 individuals have gotten essentially in that cluster that have gotten sick from that, that's a cluster. That that looks to be an unforced error on that individual's decision. As everyone knows, I have an executive order that if you get tested because you're sick, you go home. There's no more doing anything. You don't stop and get gas. You don't stop and get dinner. You wait for that test result, and you're at home because there's a higher probability that you have COVID. And so if what has been reported is accurate, and I'm not suggesting it's not, then that is the type of unforced error that leads to 16 other people getting sick.
So those 17, 18, 19-year-olds are probably looking forward to going to the mall this weekend. Who's going to enforce the attendance restrictions, the 50% capacity restriction that's on the mall when it opens?
Pyramid companies. So the mall management's responsible for that, as are the mask wearing, and we've had those discussions. I can tell you these 17, 18, and 19-year-olds who have COVID will not be going to the mall, or else they will have a big problem. But certainly I'm sure there will be folks looking to go to the mall and utilize the businesses. And a reminder, too, other counties are having real problems with contact tracing, cooperation, and this is serious. When somebody has COVID and you're not answering questions with intention and you're trying to mislead our contact tracing efforts, if we believe that this is intentional and this is a pattern, we'll do what other county executives have done in Rockland County, and we'll hold people accountable. We expect complete cooperation when we're talking about people who are infected with the virus or who have had exposure to the virus. That's at a level that we take very, very serious.
Are you running into that, a lack of cooperation?
We'll know if it's a couple isolated cases, or we're concerned that we may not be getting all the information from a couple different contact tracing efforts. And we're looking at what Rockland County did, and if we have to implement the same types of penalties for folks that don't want to cooperate, we will.
What kind of penalties did they impose?
I believe they have hefty daily fines on parents if their teens are not cooperating related to contact tracing. And I believe they've been enforcing these daily fines in Rockland County with County Executive Ed Day.
How did the memory care situation develop? Do you have any more information about what the source of that was?
I don't. Again, all speculative if I were to talk about it with you. I mean, essentially you have a situation where the whole facility's been impacted at this point. I think there's some folks who haven't been impacted. That's why instead of trying to create a COVID unit in a facility that doesn't have that infrastructure, just putting them in the hospitals right now because we have the capacity in the hospitals is the better short-term answer to that.
This probably would have been a facility that did get all the employees and residents tested once through the county's efforts.
Correct.
But not weekly the way nursing.
I believe they are getting tested weekly in the assisted living facilities. I believe this one does fall under New York State DOH, so I believe that they are.
So this is a nursing home?
They fall under New York State DOH as an assisted living facility. This type of facility does.
Okay.
These travelers, some of them are in states that require quarantines. Were they already quarantining before they got sick?
I'm not sure exactly when they got back into town and if they developed symptoms later on or not, Trish. Specifically, Dr. Gupta and her team understand the quarantine rules and regs with state DOH very well, so I'm sure that if these folks needed to be in a quarantine, that they were in one, or if they weren't one when they've been tested positive now, it is what it is. But the timing of this, remember, you have an incubation period where it could be up to 14 days before you get symptomatic. Then you go and get your test, and then you got another 3 or 5 days before you get those results. So I'm not sure if these folks traveled before the governor's orders or after.
Are the test times slowing down, the results?
Yes. Yes. Turn times on the tests. Right now, there is, everyone has seen across the country, there is severe pressure in many of these other states, and they've picked up tests of symptomatic and trying to do some universal testing as well. So the pressure on the labs is very, very severe at this point. So it's turn times that were 24, 48 hours will not be that for the near future.
Pyramid and Destiny USA have been very proactive about what they are doing when the mall reopens in terms of distancing and mask enforcement and traffic patterns, but they haven't acknowledged this 50% capacity yet. Have they had the conversation with you that they're aware of a limit on how many people can be in there at once and how they're going to enforce that?
Yeah, we always knew that the malls weren't going to be allowed at 100% capacity when you have restaurants at 50. So these were all, remember, we've been facilitating conversations with Destiny and the state for weeks. So even though the guidelines were new, there's always understanding of what certain rules would be when things got opened again.
For the sales tax, I know you guys are like $23 million down in the budget supposedly. How is the community going to see that coming out? I mean, no more paved roads, not cutting grass. Like, what is specifically going to be cut?
Well, we've already essentially cut a lot of things. There's certain things we need to continue to do related to basic infrastructure and certain investments to keep things going at the same time. But eventually, if we don't get federal help, the changes will be on our roster. And what that looks like at the appropriate time, we'll work with our bargaining units to address that. But you can't, we've already cut anything that was easy to cut. We had $2 million of cash for infrastructure. We cut that months ago. So we're down to the bone now. We've been at the bone. Now, essentially, if we don't get federal help, it's just going to be very, very ugly.
Would you just explain, and this is kind of a wonky, in-the-weeds question, these tax payments, how often they come in and what schedule they're on to come in?
I've learned a lot about the schedule. If you think about it, I don't know if anyone's ever had to, anybody's ever been self-employed and you make quarterly tax payments, estimated tax payments, because nobody's taking out taxes out of your income. So sales tax, you make estimated payments, and then you have actuals, and how the state receives them, they bring in an estimated payment for a period and another estimated payment for a period, and then a cleanup for that period, and the cleanup may be 2 or 3 payments later. So today is, what, July 10th, or July 9th, I think, and this payment was a cleanup for March, April, and May. So that's how we're always getting information from. Our closest payment that we've received reflective of Phase 3 activity was we received a payment, the second payment of the day. We had two payments, which was down 20%. That payment was down 20%. That reflected the June 1st to like June 18th period. So our next payment in August will reflect a period of June, and then there will be a cleanup, and then we'll have July. So we're always working on information and data that's really 30, 45 days old, and that's the challenge we have now.
But you get more payments than quarterly. They sound like they come in more often
Yes.
than 4 times a year. Okay.
Yes.
When can people expect the guidance for weddings?
We've been asking that question, Trish. It's complicated. We've put out suggestions on how you can do it. That's not my decision. That's the state's decision. But we believe there's a way to do it. It will involve testing to do larger numbers. So whether the state takes our recommendation or not, we'll see.
How about fitness centers, gyms, movie theaters? I think people expected guidance to be paired with the malls. To their disappointment, it wasn't. What's the status of those other businesses?
Yeah, we're hoping maybe next week we get something. We got something this week. We're hoping that next week we can have things with gyms. I think gyms should be using, a lot of gyms already have this, but registration systems are going to be critical for contact tracing, to know who was there, and if you know who was there and where in your facility too, even better, because there have been cases in gyms in other states. There's no question about that. So knowing that, I don't know what the regs will look like, but I'm sure contact tracing and knowing who's in your facility when will be part of that.
Do you know how slow the lab times have gotten on the tests? What the turnaround is now?
I think it's at least 3 to 5. It will probably be the best. I have heard some labs are back to 5 to 7 business days. And again, that's why people should remember my executive order. If you're symptomatic, it doesn't matter if it takes 9 days. You're not going anywhere. So work with your families, and if you need help, we can still help to get you things you need. If you're asymptomatic, that doesn't apply. But symptomatic, if you're sick with the symptoms, there's enough reason to believe that you have it. So we need you to stay in that quarantine.
Do you know if Destiny has to upgrade every air conditioner on their roof? Because there are dozens of them. I've seen them. Do you know the specifics, if it's a tenant responsibility or the mall?
I'm not a mechanic, and I don't know their lease, and so I'm not going to answer that.
I'm just wondering what they've told you about the process.
Yeah, I don't know who's responsible. They're the property owner. I don't think, I'm doubtful that tenants are responsible for that, but I don't know how many they have to do or what. I know they've had to make improvements and are planning on making more improvements to their portfolio in New York.
And do you know the grace period you mentioned yesterday?
I don't. I haven't had time to review all the different guidances yet.
We've seen with the Rye Day party and now Graduation Day party where within like a week or two there's been a spike in cases or cases affiliated with these large gatherings. Are you concerned at all about 4th of July last weekend and how that might impact the numbers?
One of the parties that we're talking about, there was the same group of friends went to a couple different ones, including a 4th of July event. So we'll see. Yeah, I think we'll see. Other communities saw Memorial Day activity happen. They've seen different events in the community. We'll see communities spread cases from 4th of July, no question. People are getting together and having a good time. That's one thing. If you're going to be in each other's faces, like, you got to wear a mask, even if you know them. You don't know who they had contact with or whatnot. So that's how we kind of mitigate that threat. And nothing's perfect, but it's worked to date. So I'm sure we'll see over the next week more cases related to 4th of July. Hopefully we won't see any clusters. The clusters is what drives cases for 2 weeks.
So it's about 40 kids at 2 different events. Is that what you're thinking?
Yeah, we think there's at least 40 kids that had contacts, essentially, with positive kids. And so we're comfortable with the contact tracing efforts and everything.
But it's a multiple events. They were
yeah,
kind of
2 small ones, 1 larger one. So think about it. Remember, Andrew, you were in high school. You were hopping around. I know you were. So that's what you got your senior year, your summer, your senior year. you got a lot of things you got to do before you go to college. So I get it. I was lucky when I was a senior way back when. We didn't have COVID. We didn't have a pandemic that year. So I was able to get away with more. These kids have been burdened by this virus many ways. So now what we got to do, we got to learn and we got to get tested.
Do you have any insight into schools reopening?
I don't. I think in schools really, we got to figure out a way to get it done. I think the distance learning is better than no learning. It is not a substitute for schools. And certainly the economy, if we can't figure out a way to get it done, the economy will be impacted, but the children will be impacted and really set back as well. So I think we got to figure out ways and get creative. I know the educators and districts are working on that as they have a period of time to develop plans, and we'll certainly use our infrastructure to help districts get open, and we look forward to being a good partner.
Ryan, are local healthcare facilities or other facilities running short on PPE? I'm hearing that shortages are getting bad again.
I read that. I don't remember where I read that, but it hasn't been brought to my attention yet, Tim. I'm anticipating that our hospitals probably stocked up pretty good after we went through our kind of surge and came back down. There was a period of time where the country wasn't surging after our surge. It makes sense if it's running a little low now. Every corner of the country is facing this now in a larger, sustained way. So shortages and delays should be anticipated now.
Well, especially testing facilities with their volumes being up must go through a lot of it. You haven't heard about any local?
I haven't really on tests. I think that the labs have done a nice job with building capacity, and there's more labs that are online now dedicated to this. So it's vetting some of these labs, bringing on new partners. And again, we're looking at this at all times too. If turn times get to the point where it's slowing down our ability to really tackle this virus, we'll bring on a couple more labs to help with that. But right now, I think it's a moment in time. I know Quest, for example, is expanding their national capacity this month to address this. So I'm pretty confident their turn times they've been solid, will get better in the near future here.
What have you guys discussed in the control room this week?
Well, we were happy with getting Destiny open, certainly Great Northern Mall, a lot of small business owners in that facility that were kind of being punished because they were in a mall. Haven't had any communication with the ownership of Shopping Town Mall. Wonder why, but this is a big win for the community. You look at where our sales tax payment came in today, it's a reminder. Destiny is not the end-all be-all for us, but it drives spending, and you need people to get back to work. These large unemployment checks are going away at the end of the month. And so we need to get people back to work so that they are spending money as well. So overall, that was a big thing, pushing on some of these outstanding items that you've already asked us about as well, and some regulatory things that we see. We talked to the state about different larger companies that may or may not be working with us on masks, and with customers coming in and asking them to use some of their influence to help us, alleviate some of those complaints as well.
Has the county fined any of those companies?
I think we sent out our second fine letters to a couple of them, Tim. I'm not sure where law department is on that, but we sent out an initial letter and to them, warning them, and then I know at least one of them there was more complaints in. So. We have a busy law department dealing with these COVID-related enforcement actions.
Who is that one company?
Well, certainly Walmart hasn't been the best to work with.
Are they the one that got you warned?
I'm not sure. I would have to check with our law department on that.
Do we know the status of the other malls in the county as to when they'll reopen?
No. I'm not sure where Great Northern is. I've heard that Shoppingtown is telling tenants that they can't make the upgrades to the HVAC system, which wouldn't surprise me.
You've heard from neither ownership?
Well, we're suing each other with Shoppingtown, so I don't think they're going to be coming to us. They owe us millions of dollars. They've never spent money in their building. Why would they upgrade their HVAC system when we're essentially trying to take the property in the court system? So I feel bad for the tenants who are there if that's the case. I haven't had it confirmed, but our office received emails from tenants saying they believe this to be the case. That's really not the right thing to do, but Moonbeam hasn't been doing the right thing for a long time. Now, Great Northern Mall, I'm hoping, is looking at what their MERV rating is and hopefully getting the proper upgrades there, and hopefully they're opening up this weekend.
You haven't used your Grinch analogy in a while.
No. Other questions? Okay. I want to thank everybody. I want to remind parents, please, 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 begging you, let's get these young people tested so that we figure out who's asymptomatic, if anyone's symptomatic. It's flying around in these social circles. It's not just one high school. It's multiple kids from multiple schools. They're all friends. Let's get in front of this so our kids can get off to college COVID-free. And just remind the public, we made a lot of progress, but it's still here. And we need to continue to be smart so we can continue to drive these numbers down, get our economy going, try to fight this and beat this virus off once and for all. So thank you for that. We need your help.